I want to talk about a topic that I actually have zero clinical experience on, but I'm just starting to prescribe. It is topical dutasteride. So dutasteride is the generic name for something called Avodart. And Avodart is an oral medication that blocks both type 1 and type 2 finasteride, type 1 or type 2, type 1 and type 2 alpha reductase, which means that it blocks close to 100% of circulating dihydrotestosterone. And that means that there is less of a chance for progression of male pattern baldness. It doesn't mean there is no chance, but the side effects are higher. And that is why I've steered away from prescribing oral dutasteride or oral Avodart if all possible. Now there has been a formulation of a topical dutasteride, which again I'm just starting to prescribe to patients. It is double the cost of topical finasteride, but promises to be potentially more powerful in stopping or slowing down, I should say, the male pattern hair loss. So in general, I don't prescribe Avodart, which is the oral version of dutasteride, but I am starting to prescribe topical dutasteride. So if you're my patient and you're advancing with topical finasteride, I may consider to put you on topical dutasteride. Now, just like any kind of alpha reductase inhibitor that is out there, like propecia finasteride, I would not give it to a premenopausal female, and I would not give it to someone that is being exposed to a pregnant female that could ingest the topical ingredients. So this is actually more for my patients that are getting topical finasteride and maybe they're still advancing, especially for the young patients that want a more aggressive treatment to try to slow down and reverse their current state of hair loss. I'm now exploring topical dutasteride and we'll give you updates over the next couple of years to see how this works. But to me, it's potentially promising as a therapy that minimizes potential side effects and offers an improved therapy for men in particular who are seeking restoration of their hair loss. What's interesting, though, of note is oral dutasteride, which is prescribed in various degrees. Again, I don't like to prescribe it because of how strong it is, but some people prescribe it, the 0.5 milligrams, once a day. Some do it 3 times a week, some do it twice a week, some will do it once a week, and it really is something that there's no clear consensus, but it has a much longer half-life than finasteride, which is blocking only type 2 alpha reductase and blocks about 69% of circulating DHT versus about 99% with dutasteride. What's also interesting is that in other countries such as Korea, and I can't recall, there's one other country that actually has gone through full phase 3 clinical trials to manage hair loss using dutasteride, and they've shown clinical efficacy through all 3 clinical phases. Just in the United States, the company that makes Avodart decided not to spend the millions of dollars to try to go through FDA clearance for it as a therapy for hair loss. And one other aside, I think everyone knows that it is FDA cleared for prostate, so therefore it is perfectly legal for a doctor to prescribe it for hair loss if he counsels you about the pros and cons, limitations, warnings, etc. So it's not illegal, so it is FDA cleared for use in the United States. It's just not FDA cleared for use for hair loss, and therefore it is an off-label indication.